Hey team, it's Dr. George here, and this week ATAGI released some information about monkeypox vaccine, and I know people are very keen to learn about what's going on. We're seeing it roll out in America, we're seeing it roll out in the UK, and we will soon be seeing it roll out in Australia. So ATAGI has announced that there are going to be two vaccines in Australia. There's the JYNNEOS, which is the new vaccine, non-live, so it can be used in people with immunocompromised, people living with HIV, and people with severe dermatitis. And also the ACAM 2000, which is the older second generation smallpox vaccine. And but it can't be used in people with immunocompromised, people living with HIV, and people with severe dermatitis. Now, the JYNNEOS is 2 injections separated by 28 days, and the ACAM 2000 is one sort of interesting immunisation in that it's a little bit like a scarification tattoo, and you got to look after it, but that's a once only kind of deal. So who is eligible for the vaccines? They are basically saying anybody who has had a monkeypox exposure in the past 14 days. Gay, now this is their words, not mine, okay? Let's be clear about that. Gay, bisexual, and other men who have sex with men who are at the highest risk of monkeypox infection due to having high number of sexual contacts. Risk criteria may include those living with HIV. Interestingly, HIV, we're not sure whether actually living with HIV infection is there is something about it that means that you might be more vulnerable to monkeypox, and you certainly might be more vulnerable to a more severe infection. And I think that is independent of number of sexual partners. Anyway, I move on. Recent history of multiple sexual partners, participating in group sex, attending sex on-premise venues. Other proxy markers, such as recent sexually transmitted infection, people who have been on PrEP, but they also acknowledge that not everybody who's on PrEP is having large numbers of sexual partners. Sex workers, anybody in the above risk categories who is planning to travel to a country experiencing a significant outbreak. Well, we're kind of running out of countries that aren't having significant outbreaks, so I would say international travel with that. And immunisation providers who are giving the vaccines. They also say that if you've had the smallpox vaccine as a kid, we kind of stopped doing those in the 70s, and it's been more than 10 years since you've had the vaccination, if you're in the risk groups, you can absolutely consider getting a booster as well. Now, all that excitement aside, I was like, okay, that's great. How do we help people access this vaccine? I phoned up the local health service, wasn't able to get through, but I did send an email to State Health. And the basic crux of it is that it was great that ATAGI made this announcement, but we don't actually have the vaccines yet. There is going to be a coordinated approach across Australia between the states to make sure that the people who need the vaccine the most will get the vaccine. However, at this exact point, we don't even have the vaccines, and more news is coming. So I urge you, good stuff is coming. Vaccines will be available soon, but please be patient. ATAGI kind of jumped the gun, giving out the information, causing the excitement, but really we didn't have the vaccines just at this point. But we do know that they have been requested, they've been ordered, and they are on their way. So good news is coming soon. There we go. That's what's happening with regards to the monkeypox vaccines here in Australia. Keep your eye on the horizon. I will be as well, and stay safe, team. See you then.